Suicide is when a person takes his or her life due to many different reasons. It is one of the leading causes of death in the world, and it is estimated that 1 million people die by suicide every year.
About 1 million adults attempt suicide every year, according to the CDC. Worldwide, 800,000 people die from suicide, according to the World Health Organization. There are about 44,000 people who try to commit suicide every year in the U.S. From the ages of 14 to 34, suicide was the second leading cause of death in 2015 and the third leading cause of death for children from the age of 10 to 14, according to the CDC.
Biological researchers relied largely on family pedigree studies to support their position that biological factors contribute to suicide behavior. Laboratory studies have offered more direct support. One line of research focuses on serotonin. The activity of this neurotransmitter has often been found to be low in people who commit suicide. One possibility of how low serotonin increases the likelihood of suicidal behavior is that it contributes to aggressive and impulsive behaviors. Research indicates that low serotonin activity combined with key psychological factors may be the strongest suicide predictor of all. Suicide is thought to be an extreme expression of self-hatred and self-punishment. Freud and other psychodynamic theorists have challenged this idea over the years, but themes of loss and self-directed aggression generally remain at the center of most psychodynamic explanations. Says the probability of suicide is determined by how attached a person is to such social groups as the family, religious institutions, and community. He predicted that societies with more opportunities for change in individual wealth or status would have higher suicide rates. This prediction is supported by research. He also stated there are several categories of suicides: egotistic suicides, altruistic suicides, and anomic suicides.
Edwin Schneidman defines suicide as an intentional death, and he believes that these deaths all fall into a particular category. The first category is death seekers, and these people clearly intend to end their lives at the time they attempt suicide. This could be someone who was fired from a job and became very depressed trying to make money. They then become depressed and contemplate suicide for weeks, and then one day they become clear and there's a desire to die. They end their life without a second thought, and that's that. The second category is the death initiators. Like death seekers, they clearly intend to end their lives, but they act out of the belief that death is already underway and that they're just speeding up the process. Many suicides among the elderly and sick fall into this category. The third category is death ignorers. People that do not believe that their self-inflicted death would mean the end of their existence. Fourth, there are death darers. People who experience mixed feelings about their intent to die, even at the moment of their attempt.
There are a few very common triggers for suicide attempters. First, there are stressful events and situations. Researchers have counted more stressful events in the recent lives of suicide attempters than the lives of non-attempters. Second, there's social isolation. Researchers have found a high risk for suicidal behavior among those who feel little sense of belongingness, and they believe that they have limited or no social support, live alone, and have ongoing conflicts with other people. Third, there are serious illnesses. People with serious illnesses that cause them great pain or severe disability may try to commit suicide, believing that death is the only way out. Fourth, there are abusive and repressive environments. Victims of an abusive or repressive environment from which they have little or no hope of escape sometimes commit suicide. Some prisoners of war, inmates of concentration camps, abused spouses, abused children, and prison inmates may try to end their lives because they feel that they can endure no more suffering. Fifth, there is occupational stress. Some jobs create feelings of tension or dissatisfaction that may trigger suicide attempts. Research has found particularly high suicide rates among psychiatrists and psychologists, physicians, nurses, dentists, lawyers, police officers, farmers, and unskilled laborers. Sixth, it is from mood and thought changes. Many suicide attempts are preceded by a change in mood. The change may not be serious enough to warrant a diagnosis of a mental disorder, but it does represent a significant shift from the person's past mood. People will often develop a sense of hopelessness, and people that reported feeling hopeless were 11 times more likely to commit suicide over a 13-year follow-up period than people who did not feel hopeless. Seventh, there is alcohol and drug abuse. Studies show that as many as 70% of people who attempt suicide drink alcohol before they do so, and other drugs have a similar tie. Eighth, there are mental disorders. Although people who attempt suicide may be troubled or anxious, they do not necessarily have a psychological disorder. Nevertheless, the majority of all suicide attempters do have such a disorder. Researchers suggest that as many as 70% of all suicide attempters have experienced severe depression, 20% chronic alcoholism, and 10% schizophrenia.
Some risk factors may include mental disorders, alcohol and other substance abuse disorders, hopelessness, impulsive tendencies, history of trauma or abuse, major physical or chronic illnesses, previous suicide attempts, or recent loss of job or relationship. Some warning signs may include if a person is talking about killing themselves, feeling hopeless, being a burden to others, feeling trapped, or having an unbearable pain. A person may increase the use of drugs or alcohol, isolate themselves, sleep too much or too little, reckless driving, increased aggression, looking for a way to kill oneself, giving away prized possessions, or visiting or calling people to say goodbye, or a change in personality. A person may display one or more of the moods: depression, anxiety, loss of interest, irritability, humiliation or shame, sudden calmness or relief, extreme mood swings, or sudden calmness.
Many may ask, what should I do if someone is suicidal? If you believe someone you know is in immediate danger of killing himself or herself, first, do not leave the person alone. If possible, ask for help from friends or other family members. Second, ask the person to give you any weapons he or she might have, take away or remove sharp objects or anything else that the person could use to hurt himself or herself. Then, if the person is already in psychiatric treatment, help him or her to contact the doctor or therapist for guidance and help. Try to keep the person as calm as possible and call 911 or take the person to an emergency room as soon as possible.